Today I'm going to be doing a presentation on congestive heart failure, readmission rates, and causes. I want to talk a little bit about what congestive heart failure is. Congestive heart failure, otherwise known as CHF, happens when the heart cannot pump enough blood and oxygen to support other organs in the body. Congestive heart failure is becoming increasingly more common in the United States, and as a result, there has been a growing amount of hospital admissions and readmissions. CHF is the most common diagnosis of hospitalized patients over the age of 65. Patient education is a key factor in preventing CHF. Those already affected can manage the disease by being compliant with medications, regular doctor visits, and maintaining a healthy diet. For our research, the literature review that we did focused on websites related to symptoms, complications, and treatments. We researched peer-reviewed articles related to CHF statistics and readmissions, and we narrowed our search to relevant articles using inclusion criteria of CHF, correlation, and readmission. For the methods, we used secondary analysis of correlational research studies, statistical calculations, those being count totals and the chi-square test. Each patient in the sample data set had a specific gender and admission source listed. For the data set, the total number of patients in the study was 390 patients, 198 male patients, and 192 female patients. The source of those admissions, they were 177 emergency room patients, 141 physician referral patients, 41 patients that were transferred from other hospitals, 20 patients transferred from skilled nursing facilities, 9 patients transferred from another healthcare facility, and 2 patients from a clinic referral. All of those totaled up to the 390 patients in the study. For the data analysis, data was gathered to assess CHF readmissions based on the source of admission and patient's gender. Total counts were done to calculate totals in each category of admission source and gender. The chi-square test was run to test the null hypothesis. Observed counts were compared to the expected counts with an alpha level of 0.05. Now I'm going to show you some charts and graphs that we constructed with the information in the study. This chart shows the total admissions by gender, and as you can see in the chart, female readmissions are only 6 patients less than male readmissions. The next chart I'm going to show you represents the total admissions by source, and it's a pie chart. And as you can tell by the pie chart, the emergency room is responsible for most readmissions in this sample. Here's the chi-square test that we ran, and we did it in Excel using the chi-test analysis function, and it was calculated at 0.705, which is significantly higher than the alpha level of 0.05. There were some limitations to this study, the first being that we were limited to the data from the CMS dataset, and the second being that we were limited to the sample size from the CMS dataset. Overall, in conclusion, based on the statistical test performed, we determined that there is not enough evidence to prove an association between gender and emergency department admissions. This answered our question of whether or not there is any correlation between CHF readmission, the source of admission, and patient gender. Here's a list of references that were used in this presentation. Thank you for your time and for listening.